Kristin. I'm going to be talking about bone marrow aspirate bone grafting. So bone grafting is the second most common type of tissue transplant globally, and the gold standard right now method is iliac crest bone grafting. And this is used to treat nonunion fractures, which happen in 5 to 10% of long bone fractures. This gold standard method is associated with donor site morbidity, including pain, injury to the superior gluteal artery, injury to the lateral femoral cutaneous nerve, and hematoma. So this has prompted the search for less invasive alternative methods for some patients. So our objective is to assess the union rates between bone marrow aspirate with Allograft Can-cellous chips compared to autologous iliac crest bone grafting and the reamer-irrigator-aspirator system in the treatment of long bone nonunion. So we conducted a retrospective cohort study at a level 1 trauma center with 112 patients total. Our exclusion criteria were less than 6-month follow-up, hypertrophic nonunion, pathologic fracture, skeletal immaturity, or more than one of the techniques being used. So our inclusion criteria were just one of the 3 techniques being used for their bony defect. So our first set of photos there on your left just shows the method, 2 radiographic photos of the bone graft being packed into the defect. And this method was really used across the 3 groups. And then the next photo, next to that one, is how the bone marrow aspirate method is made. So we take the sample from the gluteus medius pillar, and we mix it with the cancellous chips, and then allow it to congeal. And then we're ready to pack that into the defect like the former picture. So across the 3 groups, the most common type of initial management was an open reduction internal fixation, with intramedullary nailing being the second most common type. These methods did depend on the attending surgeon and were similar among the 3 groups. So I just want to include that. So of our outcomes, 2 were very interesting. One being the 88.9% union rate of the bone marrow aspirate group. The union rate for the iliac crest bone grafting group, which is our current gold standard, was 72.1%. And for the reamer-irrigator-aspirator system, that union rate was 83.3%. The difference between these groups was not statistically significant. However, the bone marrow aspirate group did not have any donor site morbidity in our study at 0%. You can see it circled up there. While the iliac crest bone grafting group had a donor site morbidity of 19% and the reamer-irrigator-aspirator system at 4.8. So this was statistically significant with our p-value of 0.013. So the length of hospital stay, number of unplanned operations, and deep infection rates were similar among the 3 groups. We didn't find any significant difference in those. And then most patients were initially non-weight bearing for a period of time after their procedure as well. So just our takeaway from this study is that this study works to demonstrate that the treatment of long bone unions with the bone marrow aspirate method may be a reliable alternative to the iliac crest bone grafting method and offer less donor site morbidity. So what we're working on in the future is to collaborate with other centers doing similar studies to see how these numbers play out in a bigger patient population. What questions do you guys have?
I guess, how did you at first get involved in this? Was this already happening in your, I guess, facility?
The study itself was just starting up when I was in my 2nd semester, 1st year, so 2 years ago. Most of the procedures had already been done, but Dr. Quaid, the primary investigator, really wanted to see the outcomes. So we did a chart review.
And is the study completed, or are you guys still continuing to work on
So
it?
this is complete. This is all of our data from our facility, but there are other facilities starting to do these projects. So hopefully soon we'll do a meta-analysis. So everything was greater than 6 months. Average, it was between 6 months and 18 months. So anything less than 6 months, which excluded a lot of patients for us because we're a huge referral center, so we lost a lot of patients in follow-up, but they weren't included in the study.